Today we are going to discuss very important topic of physiotherapy. We have with us a very renowned doctor, Dr. Nazneen Rana. She is a well experienced physiotherapist and a nutritionist. Welcome, Dr. Rana. So nice of you to join.
Thank you so much, sir.
Yes, thank you. So, can you tell us something more about your self and your field of expertise, Doctor?
Yes, sir, sure. Sir, I am Dr. Nazneen. I have passed out my this Bachelor of Physiotherapy from Hospital, Hospital, and I'm practicing in Ahmedabad since 2006. So I'm having 13 to 14 years of experience, and I have
Wow.
yes, sir. I have worked with big hospitals like Krishna Heart Hospital. I work with Dr. Rajesh Desai sir, who is a very known heart surgeon for 4.5 years. I was there for ICU therapist, and I worked there as ICU therapist for 4.5 years in Krishna Heart Institute. After that, I have worked with Life Cell Hospital, Life Care Hospital, Sanjeevani Hospital, and Susrusha Hospital. And
Hmm.
from 2009, I have worked with international company which is LifeCell. Uh, they are basically work with pregnant ladies, and we are conducting different kind of antenatal care program since 2009. So I have 11 years of experience regarding antenatal program as well as postnatal program, and I work with big gynecologist in Ahmedabad like Mayflower Hospital, me and mommy, and very different state hospital. So I work with different gynecologists in Ahmedabad also, and I've started my own clinic since 2013, and I have seen, like, I have cured so many different chronic patients related with orthocases like arthritis, frozen shoulder, sciatica, back pain, lumbar back pain, and some neurological difficult cases like paraplegia, hemiplegia, and developmental delay cases. So I have worked with ortho as well as neurological cases, and I've treated them 100% with my 100% dedication, and they got result.
Awesome. Awesome. I'm really
Yes.
impressed by your track record. Doctor, can you tell us why physiotherapy is important?
Yes, sir. Sir, in physiotherapy, first of all, there is no side effect of physiotherapy. You can use it, you use as a alternative therapy. Like if you, for simple example, if I tell you, if somebody has a myofascial back pain, only muscular pain is there, and somebody is taking painkillers, so painkiller on a long term basis will give you side effect like liver failure, kidney failure, and so many problems. But in case of physiotherapy, we can use some massage technique, we can use dry needling, acupuncture technique, we can use some kind of manipulation technique which are really good, where we are using just our hand and we learn the technique. So with our hand only we can cure them without any side effect. And we can use our electrotherapy also with checking all contraindications. So
Uh-huh.
electrotherapy also gives them a good pain relief. So they don't need any kind of painkillers on a long term basis. So with physiotherapy, we can control so many muscular as well as orthopedic problem, neurological cases without any side effects. So physiotherapy is very important.
Oh yes, that's really nice to know that there is no side effect. This is one of the most
Yes.
important things about physiotherapy. Dr.
Yes.
Nazneen, can you
Yes.
tell us some three things that we must do to improve our health in this context?
Yes, sir, definitely. Sir, we have to just focus on our physical health. And for physical health, we need to have our stamina, our endurance, and muscle power. These three things are important, and all these three things will like we require some kind of exercise. Each and every individual require exercise in different forms. For elders, we have a geriatric exercise. For younger patient, we have a cardio exercise, which is high intensity exercise. For kids, we have different kind of sports activity which gives them proper exercise. So for different people, we have a different exercise, but exercise is must to gain your stamina, your muscle power, and your endurance.
ओ यस दैट्स राइट। मतलब सभी एज ग्रुप के लोगों को एक्सरसाइज करनी बहुत आवश्यक है, छोटे
सही
हो,
में।
जवान हो या मेरे जैसे सीनियर सिटीजन हो, एक्सरसाइज तो बहुत जरूरी है डॉक्टर नजरत। सो दैट इज वेरी गुड यू सेड दैट, बट कैन यू टेल अस तीन चीजें जो नहीं करनी चाहिए, कुछ
हाँ,
नॉट टू
यस
डू। या
sir. Actually, every patient is different. With same condition, also patient behaves differently, different in different conditions. So, if patient somebody has a frozen shoulder, for example, and somebody teaches a same patient teaches other patient, okay, I'm learning this exercise, I'm doing this, you also do this. So, self exercising without consulting your physiotherapist doctor is dangerous sometimes.
हाँ ओके। सो वो अपने आप को डॉक्टर नहीं बना देना चाहिए। दैट्स
Yes,
दैट्स
sir.
रियली कूल डॉक्टर नाज़रीन। कैन यू
Yes.
जस्ट टेल अस समथिंग अबाउट द सिम्टम्स? कोई ऐसे सिम्टम्स हो जिससे हमको पता लगे कि भाई फिजियोथेरापी बहुत जरूरी हो गई है? एनी मेजर
Yes, sir.
सिम्टम्स?
Sir, different, like if you are doing your routine of work and if you are tired by doing that work, or if you have any kind of muscle pain, or you heard some kind of bony noises, if somebody has arthritis, so they can hear some kind of crackles in their bones, and they can hear whenever they are just doing stair climbing, or whenever they are lifting some weights, so they can hear some kind of like bony voices. So that crackle voice uh, remind you that it is a bony problems. If muscle is there, so you will have a swelling, some kind of swelling pain, and so much of pain is there. So you will come to know that day by day routine activities is getting difficult for me. So now I have to consult my physiotherapist doctor. So by
ओके।
doing normal activities, patient will have a pain or any other kind of a symptoms like swelling, redness, and other shooting pain is there. So patient will come to know, okay, you have to go to a physiotherapist doctor.
ओ यस दैट इज इम्पोर्टेंट।
Yes.
मतलब आवाज सुननी चाहिए। बिल्कुल।
हाँ.
बिल्कुल। Dr. Nazneen, can you tell us something about your case, some interesting story, or you want to break some myth? कोई अंधश्रद्धा हो जो आप तोड़ना चाहें?
हाँ. सर, मेरे पास न्यूट्रिशन रिलेटेड बहुत सारे केसेस आते हैं, पीपल यूज टू कम टू अस, और उनका ओबेसिटी से रिलेटेड ये होता है, बिकॉज ओबेसिटी इज ग्लोबल प्रॉब्लम nowadays. So they have a myth, okay, if I eat less, or if I skip my breakfast in the morning, or if I skip lunch or breakfast, and throughout the day if I don't eat so much things, if I do fasting, I will lose my weight. So that is a myth, big myth, because you are just changing your metabolism, you are disturbing your metabolic system, and day by day you will gain your weight instead of losing your weight. So by not eating or skipping the meals is not a right idea to losing a weight. Only exercise and calorie control things only gives you a calorie burning things and give you a losing weight.
Oh yes, एब्सोल्युटली। मतलब ये जो मिस करते हैं और ये जो गलत डाइट प्लान जो अडॉप्ट करते हैं,
Yes, yes.
वो ठीक नहीं है। तो ये
Hmm.
बहुत अगत्य की बात बता दी आपने। तो दर्शकों, हमारी ये ऑनलाइन मिलियनर हेल्थ समिट में हम डॉक्टर नाज़नीन जैसे बहुत सारे हेल्थ एक्सपर्ट के साथ बात करेंगे। और ये जो कोर्स है हेल्दी हमेशा, इसके साथ आप जुड़े रहिए। आप मेरे को एक और बता दीजिए कुछ आदतें हमको अच्छी आदतें रखनी चाहिए या कोई इजी वे टू इनकलकेट दीज हैबिट्स इन आवर डेली रूटीन, डॉक्टर नाज़रीन?
यस सर, श्योर सर। सर पहले तो हमें कोई भी एक एक्सरसाइज हमारे रूटीन में ऐड करनी चाहिए, वेदर इट इज रनिंग और वेदर इट इज स्टेयर क्लाइंबिंग और वॉकिंग। वॉकिंग इज वेरी सिंपल एक्सरसाइज, यू कैन वॉक at your terrace, your compound, and you don't need any kind of equipment in walking. So you need only a good shoes and just start walking. So only doing walking 30 minutes give you so many benefits for your cardiovascular system, your musculoskeletal system. Your bone will strengthen, your muscle will strengthen, your heart pumping will be benefited, your lungs and heart coordination will be improved. So overall, our aging process gets slower, and we can prevent so many diseases which is related to lifestyle disease, which are hypertension, diabetes, hypothyroidism, obesity. These 4 5 diseases are like lifestyle diseases we can call. Because of our bad lifestyle, we have pursue this kind of diseases. So we can prevent all kind of lifestyle diseases with just walking. So we can start any of exercise like walking at home, and we can start good nutritious food which is fresh fruits and vegetables. We have to include in our diet 2 to 3 different color of fruits and 3 different color of vegetables. We can say your dish should be like a rainbow. If it is like a rainbow, you will get full 13 vitamins and 11 minerals nutrition value. And take 1 glass of milk every day, and don't eat any kind of like preserved food or unhealthy food or container food which are having some kind of preservative. So avoid that kind of container or bahar ka khana. So, and every 2 to 3 hour we have to take small meal instead of big portion. We have to eat small portion. So
Okay.
it will boost your metabolism, also gives you energy throughout the day, and you will not put most of the weight. So these 3 things are important, I think.
बहुत बढ़िया, बहुत अच्छी तरह से आप समझा रही है। और ये बहुत जरूरी है। मतलब आपने जो बताया चलने के लिए, जो 40
Yes,
के बाद नहीं चलेगा तो नहीं चलेगा, फिर
नहीं
वो
चलेगा।
चलना ही चाहिए।
सही
मतलब
है।
वो अपने को वी हैव टू इनकलकेट दीज हैबिट्स एज डॉक्टर नाज़रीन एक्सप्लेन
Yes, sir.
सो नाइसली that in the diet also we
Yes, sir.
should avoid such packaged food and preserved food. वो
Yes, sir.
प्रिजर्वेटिव जो केमिकल है वो भी अच्छे नहीं है। और
Yes,
ये भी मैं बहुत अच्छी तरह से समझ सकता हूँ। जैसे मैं भी साइंटिफिक मेडिटेशन सिखाता हूँ, तो ये
oh,
बातें हम जरूर बतानी चाहिए कि भाई साथ में अच्छा डाइट होना भी जरूरी है। Or as I
yes,
understand, Dr. Nazneen, you are also expert in nutrition, and
yes, sir.
you have spent so much of your time today in spite of
Yes,
your busy schedule. I know you are very busy with so many doctors, and
yes,
you have really spent this time on online interview. Thank you very much. Before we conclude today's interview, I would like you to please tell something about this online millionaire health summit. आप दो शब्द बोलेंगे जरा प्लीज?
sir. Yes, yes, sure, sir. Thank you so much, sir. You, Mr. Zaveri, sir, and Dr. Vimal Rathis, who gave me the opportunity to just give you an interview. And sir, and you people are doing so much, so such a great work. So I think it's a very good thing to initiative and working towards the preventive some kind of diseases is a very noble cause, and my all best wishes are there. Sir, thank you so much for giving me this chance.
Okay, thank you.
Thank you,
Okay,
sir.
let's keep in touch.
Yes,
Okay,
sir.